mynews.studio.
Mosquitoes in Bangladesh, eye infections in Iraq, and a new vaccine factory in Rwanda. What connects them, and in what ways are they quietly changing the direction of global health?
Today's date is 2025-11/20. Let's start by looking at what's changed over the past year. We've seen the rollout of new vaccines for malaria and RSV, finally reaching people who need them. At the same time, diseases like kala-azar in Bangladesh and trachoma in Iraq have been eliminated. That's not something you hear about every day.
Right, and it leads to an important question. Is this just scientific progress at work, or is there more to it? When you dig deeper, you notice these results are the outcome of intense global collaboration. Take the elimination of kala-azar in Bangladesh or trachoma in Iraq. These didn't disappear because of a single organization. It took governments, the World Health Organization, NGOs, and local health workers all working together.
So it's not just a story about scientific breakthroughs in the lab. It's about actually getting treatments and prevention to people on the ground. But I wonder, how did these partnerships work in practice? What did that look like day to day?
They coordinated everything, from technical expertise and funding to outreach in remote villages. Local health ministries set the policy direction. NGOs brought grassroots understanding and access. And then organizations like WHO offered data, logistics, and global standards. That combination made for quicker responses, wider coverage, and real-time feedback. Could any single group have managed all that alone?
No, definitely not. And that's a big lesson here. The same principle applies to the new mRNA vaccine factory in Rwanda. It's Africa's first, and it didn't just appear out of nowhere. BioNTech, CEPI, the European Investment Bank, and the European Commission all contributed, pooling money, technology, and regulatory support.
And the impact is concrete. Africa can now manufacture its own vaccines, which reduces reliance on imports. But I keep coming back to sustainability. Is opening a factory by itself enough to secure long-term vaccine supply?
Not really. There are ongoing challenges. For the factory to keep running, Africa needs steady investment, not just the initial funding. That means governments and regional organizations stepping in after the international partners have launched things. And of course, skilled workers are crucial. Scientists, technicians, engineers. How do you make sure they stay and don't get overwhelmed or leave?
Training and keeping talent is a constant hurdle. There's also the issue of aligning regulations. If every African country has its own vaccine approval process, distribution slows. So, harmonizing those rules is essential. And then there's logistics, raw materials, cold storage, transportation. If just one part fails, the whole system can stall.
These problems aren't unique to Africa, but the stakes can be higher. So, what can other countries learn from Bangladesh and Iraq's experience getting rid of these diseases?
First, political commitment is critical. Consistent funding over many years, sometimes decades. Second, community involvement. Health workers going door to door, building trust, following up. Third, making sure disease control is part of regular health services. If you separate it out, people can slip through the cracks, or the program can lose momentum.
And being flexible. Using real-time data to spot hotspots and move resources where they're needed most. That adaptability played a big part in these successes.
In the end, it's not just about celebrating these wins. The real question is whether these strategies can be adapted to other diseases or regions.
That's really the bigger picture. If collaboration, long-term investment, and local engagement worked here, why not elsewhere? And could this approach help us get ready for the next pandemic?
It shows that joint effort matters. We're seeing real drops in child deaths, more equal vaccine access, and stronger health systems. These numbers have real meaning. They represent lives and futures.
And it reaches beyond health. It's about fairness, stability, and being able to bounce back from setbacks. The challenge now is whether others will keep building on this progress.
Today we've talked about breakthroughs in global health, but what really matters is what comes next. Thanks for listening. This episode was produced by mynews.studio. You can try it now for free.